Accessing healthcare is difficult for Indigenous, transgender, and Two-Spirit people across the country.
Even before stepping into the door, even before, booking that appointment, I think for lots of folks, especially within the trans community, there's hesitancy and fear around the medical system.
Previously, we shared the experiences of two community members in Winnipeg calling for change. But some doctors and advocates have already started the work.
Working to
Racheal
kind of
Wu is a
provide this
sexual and
information
reproductive
provide
health
these services to
facilitator at the
people.
Sexuality Education Resource Center in Manitoba. She advocates for change by teaching service providers how to be allies to transgender people.
Often I have people asking about, can I just put like the rainbow sticker on the door or like say that it's an inclusive space? And we always tell people it's so much more than that. It's not just putting that rainbow sticker up, but it's also, like you said, making sure that staff are using people's pronouns or names or referring to them correctly as well too, because that rainbow sticker can just be a sticker if there's not that education and that follow through with it.
She says access to affirming care is only made worse for Indigenous people living outside of city centers due to less options. Dr. Shane Reitmeyer noticed these needs during his residency as a rural family physician.
They feel isolated. They feel like there's nobody that's around there that can help them. And a lot of people feel they can't feel secure in themselves because how can they if the system doesn't allow them to?
Now, 4 years into his practice, he provides services and education through his sexuality and gender program.
I wanted to be sure that I could be a place for for patients where they could see a physician where they know that they have a trusted contact that they could reach out to. And then I'm also privileged and have a platform where I can provide education and actually try and ensure that other people can offer a safe space, and maybe they just didn't have the knowledge base previously.
Despite going to rural communities like Sandy Bay First Nation and offering virtual appointments across Manitoba, Dr. Reitmeyer says some patients still travel as far as 8 hours to receive his gender-affirming care.
We want people to just be able to seek out care wherever they are and be able to get gender-affirming services. But as a doctor who provides a lot of services as well, I do get that sometimes adding something to your belt is horrifying. Right. And sometimes it's not, that sense of like, I don't know how to do this isn't rooted in prejudice, although who are we kidding? It definitely is for lots of people too.
As a Cree Two-Spirit family physician in Alberta, Dr. James McCocus suggests the need for more education within the field isn't unique to Manitoba, after receiving only an hour's worth during his own medical schooling.
We discussed some of the general issues of, what does it mean to be trans? And we had people from the community who would come in and explain their lived experience. But what we didn't do or learn about was how to manage medical hormone replacement therapy, for example, or to have examples of having a trans person as a normal part of our medical education.
He's now a well-known advocate for trans and Two-Spirit healthcare and has trained many doctors on how to do the same.
I think that sometimes in physician practices, instead of reaching out to our colleagues, the easier thing for them is just to say no, that I don't know enough. And that's not good enough of an answer.
Sav Jonesa, APTN National News, Winnipeg.